that's a burning discussion within the entire single-payer movement and within P&HP, which is, what is the roadmap and how does history change? Well, what is in a demand? Our demand is that there be a national health program that accounts for comprehensive modern medical care for absolutely everybody. That's our demand. So what's in that demand? It's a very, very, very keen idea, because the demand points out to the whole society that this is something we could do right now. The National Health Service, when it was launched in England, I just read, 2 months after its launch, 93% were enrolled. And a few months later, 97%. When Medicare was enacted, 1 year, and all of the elderly were enrolled in Medicare. In Taiwan, they enacted a single-payer program, and within months, the entire country was not only enrolled, they went from questioning it to loving it within months. And I think it was 9 months. So it's completely a practical proposal. It's something that could happen tomorrow and could happen quickly. When Hillary Clinton and other opponents of single payer say that it's not politically feasible, that's attacking our strength. It is eminently feasible. It is eminently practical. It is something that could be done. So the first thing is pointing that out, that we're not talking about if some path to this. Second thing is, it's really an incremental step to a better society. We want to radically change and profoundly change the culture of caregiving in our society. Caregiving is so essential. This Julian Tudor Hart I've been thinking about. We say that there are some things that shouldn't be commodified, that healthcare shouldn't be a place to extract profit. And we want to defend it that way. But really, there are two, as Bernard Loud says, there are two experts in the doctor-patient relationship. The patient is the expert on their symptoms. The doctor, hopefully, that partnership. And Hart points out that partnership adds value to society, and it should be understood fully for all of what it adds to all of us. And we don't think that way very much. So I think that the roadmap is to point out that we want to do this and we can do this. Then there's the question of how does history change? Because this is a pretty tall order. You're asking the United States of America, which avoided some kind of socialized medical system in the 20th century, taking this crazy detour where in World War II, because of wage freezes, benefits could be offered as an incentive to workers, and private health insurance became a benefit, and then employer-based health insurance became the order of the day in the post-war period. So the United States took that particular path. How would we then change these things? And I think that from where I'm sitting, we're in a funny spot. I think we're in a place like where Alice Paul and Lucy Burns were about the time they started being activists in NAWSA, the National Association of Women's Suffrage. No, I can't remember the name of the organization. Forgive me. The whole country thought that women should vote. Everyone thought that women should vote, but there was no way to get there. The president wasn't for it. The Congress wasn't for it. They couldn't get it through this committee. And so they just started doing everything they could do to make it happen. It had been already the campaign had been going for what? 70 years. But at a certain point, everybody thinks it should happen. And I've had this very humbling experience of going to rooms where I'm going to speak and being told that this is a hostile audience. This audience does not want to hear about single payer. They like their private insurance. This audience is conservative. These guys are Republicans. And I don't go to an audience where people don't think that everyone should have access to full comprehensive care. The idea that somebody should be left out, nobody really has that idea. So we're in a funny time that way in terms of changing things. Now the power structure is really the power structure. And our grassroots movement is really where it's at. We're in a moment where we don't have the kind of institutions that won the socialized medical systems in the other countries. Bismarck's reform was because of the social power of the labor movement, organizing. Bismarck thought, well, if we give some health benefits, some insurance benefits, then that'll work. And then coming into the early 20th century in Europe, the threat of socialism and the power of the labor movement again, made many countries move toward universal health care. Other places it took a backlash against the right. For example, in Spain, the constitution that came after Franco, right? So how do you do this? I don't think there's a roadmap where we can sit down and tell history what to do. I don't think that's how it works. I think the way it works is that we articulate the case and we keep it in the mainstream and we keep winning people, 1s, 2s, 10s, 20s, but we keep doing our grassroots work. And we know that because this is the only reform that will actually work for all the patients. This is the least increment. A single-payer system is the minimum increment of change that will work for all the patients. Nothing else will work. Anything that they try to do through private business will fail the patients. We know that that's the case. So if we keep articulating this, we will win. The question of how and when, in my mind, comes about because a lot of times there's another crisis. It doesn't have anything to do with your roadmap or what you thought was going to work. And when I think about the victory, the suffrage victory, what I think about a lot is that the posture that the radical feminists, the ones who were getting force-fed and on hunger strike and who went to Occoquan, who picketed the president during the war, they had really, really, really smart poise. They said to Wilson, we know you know that this is the right thing. You said you support suffrage so many times. We give you permission to do what you know is right. And he would say, well, I can't do anything because I'm under party discipline and my party hasn't decided to do this. I'll vote for suffrage for women in New Jersey, but as president, I can't do anything. And they said, that's okay. We give you permission to change your mind. Then, when the war came, they said, unite the country as a war measure, Mr. President. You're in war against Germany and with Russia, and those countries, women can vote. And unite the country so women in our country can vote too. Unite the country in this war for democracy. They gave him the argument. And when Wilson finally came over and gave the speech that said that they had to pass the constitutional amendment, he said, this is a war measure. We need to unite the country. He used exactly their arguments. And then he deliciously said, I want to assure you that the voices of those intemperate agitators do not touch me at all. So the courage of our convictions is this. I mean, the fact that we're getting here together tonight, I mean, this is how we will change history, is by trying to do it. And I don't think there's I don't think that you plan it out like a it's not a marketing campaign. It doesn't work like that. We're trying to change history, and it is a very big undertaking. So you can underestimate the demand that it's just could be done like that, and you can overestimate the demand that there should be some incremental way to just roll it out. So thank you. I think that's on everybody's mind. Okay, it's about 15, right?